November is Diabetes Awareness Month, and according to the CDC, close to 11% of Americans have diabetes, and another 3% don't even realize they have it. Dr. Scott Joy is the Chief Medical Officer of HealthONE Physician Services Group. Thanks so much for your time. We appreciate it.
Yeah, thank you, Dom.
I'm curious to know, how is it that someone can not know? How can they go undiagnosed?
Well, I think a lot of people aren't routinely checking their blood work that would look for a glucose level. So the United States Preventative Service Task Force recommends that all patients 35 to 70 years of age be screened for prediabetes or diabetes with a blood test looking at their glucose levels. And I think the definition of obesity or overweight is a body mass index of 25 or greater. So there are a lot of patients in that 35 to 70 age range who are eligible for a blood draw to screen for diabetes.
We've got type 1 and type 2. What is the difference between the two?
Yeah, type 1 is an autoimmune disorder. There are antibodies that attack the pancreas cells that secrete insulin. Type 2 is two parts. It's that your body doesn't make enough insulin. The pancreas kind of wears out over time, and the insulin in your body is less effective. That's a concept called insulin resistance. So lack of activity, obesity, burns out your pancreas a lot quicker, and the lack of activity doesn't allow sugar to get into the cells. So type 2 is related to that and not destruction of the cells from antibodies.
Well, what are the biggest risk factors when it comes to developing diabetes?
Yeah, definitely some ethnic risk factors. So Latino groups, African American groups are much higher risk for developing diabetes. People who are overweight, people who are sedentary, people with a family history, women who have had gestational diabetes. So those are all things that you should be talking with your primary care doctor about to understand what your current glucose status is and what you should be doing to prevent development of diabetes.
Yeah, well, let's talk about that finally. Give us some tips. Let's talk about prevention when it comes to this.
Yeah, good question. I think the diabetes prevention program was done years ago, and it showed that 30 minutes of exercise 5 times a week, and that can be 30 minutes of walking, even a brisk walk, and 5% of body weight loss over 3 years. That's about 4 to 5 pounds weight loss a year can reduce your risk of developing diabetes by nearly 70%. So small changes, 30 minutes of walking 5 times a week, losing 4 to 5 pounds in a year. It's a great New Year's resolution to think about and prevent diabetes.
Yeah, little goes a long way. Dr. Joy, thank you so much for your time today. We appreciate it.
Yep, thank you, Dom.
All right, don't forget, you can always find all of our health interviews right now on cbscolorado.com.